What if I told you that your body might be giving you little hints up to a month before a heart attack? Most heart attacks don't strike out of nowhere. Sounds surprising, right? But it's true. Subtle signs like unexpected tiredness, shortness of breath, sleeplessness, or even simple indigestion are often dismissed as stress or fatigue, but these can be crucial warnings of a looming heart attack. According to research, heart attacks are the #1 killer of men and women worldwide. When we hear heart attack, we often think of sudden chest pain and a frantic rush to the hospital. Millions of people experience subtle signs of heart trouble without even realizing it. Today, we're going to dig into 6 common signs that often appear months or even weeks before a heart attack. Recognizing these signs can give you time to act, make lifestyle adjustments, and seek medical advice. Quick reminder, we are not doctors. This video is for information purposes only. If you are experiencing a medical condition, don't hesitate to speak with your doctor. That said, let's dive in. Number 1, let's talk about the most well-known heart attack symptom, chest pain. Often described as a squeezing, pressure, or burning sensation, chest pain, also known as angina, is one of the most recognizable signs of a heart problem. But here's the thing. Many people don't realize it could show up months or even weeks before a heart attack. This isn't the dramatic clutch your chest pain we see in movies. Chest pain related to heart problems can be much more subtle. Instead of a sharp stabbing sensation, it might feel like a heavy pressure or a squeezing tightness in your chest. This pain can come and go, lasting for a few minutes or even hours, and often radiates to other areas like your left arm, jaw, neck, or back. Chest pain occurs because the heart isn't getting enough oxygen-rich blood due to blockages or narrowing in the coronary arteries. Without enough blood flow, the heart struggles, leading to that characteristic chest pain. Over time, if left unchecked, this can lead to a full-blown heart attack. Before we move on, if you're getting value from this or any of our other videos, please take a moment to hit the like button, subscribe for more health tips, and share this video with someone who could use this information. All right, let's move on. Number 2, sleeplessness. Do you ever lie in bed, tossing and turning, unable to settle down despite feeling exhausted? Many people experience restless nights, difficulty falling asleep, or waking up frequently. Surprisingly, sleeplessness might be a pre-heart attack warning sign. Our bodies need rest to repair, but chronic sleep deprivation puts your body into a constant state of stress. This lack of sleep can affect blood pressure and cause inflammation. And not only that, your heart has to work harder to compensate for the lack of rest, and over time, this can take a toll. It puts a strain on the heart and can lead to a whole cascade of problems. This includes high blood pressure, inflammation, and an increased risk of blood clots and heart attacks. So if you're constantly struggling to get a good night's sleep, especially if it's a new or worsening problem, it's important to talk to your doctor. Number 3, now let's talk about a symptom that's hard to ignore, shortness of breath. Shortness of breath, also known as dyspnea, can feel like you're gasping, struggling to get air, or taking longer to recover after mild activities. When your heart isn't pumping efficiently, perhaps due to narrowed or blocked arteries, it can't keep up with your body's demand for oxygen. If blood isn't circulating well, fluid can build up in the lungs, making it hard to breathe. This could be a sign of worsening heart function, a wake-up call for a potential heart attack. Your heart and lungs work closely together, so any changes in breathing are worth noting. If you've noticed that doing everyday activities, such as walking up the stairs, makes you feel unusually out of breath, this is something to pay attention to and check with your doctor. Up next, number 4, sweating. We often associate sweating with exercise or hot weather, but it can also be a sign of stress, anxiety, and even heart trouble. Waking up in a cold sweat, sweating during mild activities, or even feeling clammy while at rest might seem odd, but could be related to your heart. This type of sweating, often referred to as diaphoresis, isn't the sweat that comes after a good workout. It's often unexplained and can feel more like a cold, nervous sweat. When the heart struggles, it goes into overdrive, which can activate the body's fight or flight response. Hormones like adrenaline may be released, causing your heart to beat faster and pump harder. This, in turn, can cause you to sweat, even if you're not physically exerting yourself. So if you've ever been in a situation where you broke out in a cold sweat, even though you weren't physically hot, we're talking about unusual sweating, the kind that appears out of nowhere, drenches your skin, and leaves you feeling clammy and chilled. It may be the body's way of signaling that there's an issue with your heart. Number 5, tiredness and fatigue. We've all experienced fatigue, that feeling of being completely drained both physically and mentally. But what if you're constantly exhausted, even when you haven't done anything particularly taxing? If you've had a full night's rest, but by midday you're exhausted, and even simple activities that were once easy, like running errands or taking a short walk, leave you feeling wiped out. If this tiredness feels unusual or is persistent, it might be a clue to your heart health. Heart-related fatigue often feels different from regular tiredness. It's a deeper type of exhaustion that's not easily relieved by rest. This relentless fatigue can be a sign that your heart isn't pumping blood efficiently, and your body isn't getting the oxygen it needs to function properly. Fatigue before a heart attack often happens because the heart has to work harder to circulate blood through blockages. When that happens, less blood and oxygen reach your muscles, making you feel sluggish. Over time, this constant overworking of the heart can lead to further damage. Fatigue that persists, especially in the absence of other causes, could be a subtle cry for help from your heart. One way to differentiate between normal fatigue and heart-related fatigue is to pay attention to its severity and duration. If you're experiencing a level of exhaustion that's new to you, significantly impacts your daily life, or lingers for weeks on end, it's time to take notice. Moving on, number 6, indigestion and stomach pain. Even though a lot of people associate heart attacks with chest pain, heart-related discomfort doesn't always stay in the chest. Some people feel stomach pain or experience nausea and indigestion, mistaking it for a simple digestive issue. If you're feeling discomfort in the stomach that doesn't go away, it's worth taking seriously. Indigestion, nausea, and stomach pain can happen due to the heart and stomach sharing nerve pathways. As we've mentioned before, when the heart isn't functioning properly, it can refer pain to other areas, and this includes the stomach. This means your brain can misinterpret the signals, mistaking a heart-related issue for a simple case of indigestion. This symptom is often overlooked because people tend to treat it as a minor digestive issue. But persistent indigestion, especially if it's new or combined with other symptoms, might be a warning from your heart. Now, while it's crucial to be aware of these warning signs, knowing the signs is half the battle. There are practical steps you can take to help keep your heart in great shape and reduce your risk of heart disease. Nourish your body with a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Reduce salt, sugar, and unhealthy fats, which can contribute to high blood pressure and cholesterol. Find healthy ways to manage stress, such as meditation, yoga, spending time in nature, or simply unwinding with a good book. Chronic stress can elevate blood pressure, which isn't good for the heart. Engage in regular physical activity. Aim for at least 30 minutes of exercise most days of the week. Physical activity strengthens the heart, helps maintain weight, and can lower blood pressure. Quit smoking. Smoking damages blood vessels and raises heart attack risk. If you smoke, consider quitting or seek support to help break the habit. Additionally, limit alcohol. Drinking in moderation, if at all, can reduce heart disease risk. Stick to recommended guidelines and consider alcohol-free days during the week. Get regular checkups. A lot of heart issues are silent until they're serious. Make regular doctor visits a priority and keep an eye on cholesterol, blood pressure, and glucose levels. Many people ignore these early warning signs, hoping they'll just go away. But don't brush off these symptoms as nothing or think you're too young or healthy. Heart disease doesn't discriminate, and early detection is key. Remember, you are your own best advocate. Thanks for watching. We hope this video has been informative. If you found it helpful, hit the like button. Please remember to comment, share, and subscribe for more. Until next time, take care of yourself and each other.